I'm here with Dr. Herrera. She was the one who performed 2 treatments. Dok, ano po yung first treatment na ginawa niyo?
It's the radio frequency using Thermiva.
Para saan po yun?
Okay, that's actually the science of heat that addresses a non-surgical procedure with intimate dysfunctions, namely functional impairment from vulvovaginal laxity, vaginal dryness, that's from the natural process of aging, and because of aesthetic imperfections from childbirth and pregnancy, we do have some vulvar laxity and vaginal laxity.
Okay. So, what about the women who has some issues with regard to controlling their pee?
Okay, wonderful. There are women, because of pregnancy and childbirth, even the single women, sometimes they have what we call the leaky bladder, where there's the passage of urine upon coughing, laughing, and sneezing. Thermiva also increases the fascial support that supports the bladder wall that is inside the vaginal wall. And because of Thermiva, with the heat, the science of heat and massage treatment that is being delivered over the impaired areas, there is now tightening and improvement and reduction in the symptoms of urinary leaky bladder urine.
Okay. Is there a downtime after this treatment?
Absolutely no downtime, no pain, no anesthesia is needed, resumption of normal activities, even sexual intercourse is already advised.
Wow, that's great. Excited na. Kasi I had my treatment earlier already. And after this, meron pang isa, it's the PRP treatment. What is it for, Doc?
Okay, PRP means platelet-rich plasma, wherein we get autologous blood, meaning blood from the patient, and because of some centrifuge or some process, we actually separate the blood elements and we only get the platelet-rich, which is very, very rich in growth factors, actually young cells that will actually promote anti-inflammatory healing effects on the areas, particularly the impaired areas, wherein, for example, in this case, if you have urinary incontinence, it can treat this. It can also treat lichen sclerosis. This is actually itching, dryness that you find in the vulvar area, particularly seen in postmenopausal women. And this can also increase arousal disorders, where women can also, when women experience some form of orgasmic dysfunction.
Okay. So, there are so many, actually,
Indications.
Indications.
Yes.
Okay. Is there any side effect with these 2 treatments?
Absolutely no side effect, no downtime. Your PRP will not even increase risk for infection or any allergy because the blood will be coming from your own system. It's autologous and it is actually non-invasive. It is actually purely non-invasive and will not form any side effects or formations of any scars or any obstruction in the area that is being treated.
Okay, last question, Doc. Is there any age limit or yung kung at what age do you recommend the treatments?
Okay, it all depends on what the complaints are or what the personal intimate issues are. These are for your PRP. It will improve whatever whatever complaints you have. There is no age limit. For your Thermiva, the earliest patients that I have encountered is 26, and it can be as old as 80 years old, as long as there is any of the intimate dysfunctions that I have mentioned due to the process of aging, resulting in dryness, atrophy, or functional impairment from leaky bladder urine, from pregnancy or childbirth, or simply aesthetic imperfections where because of aging or because of childbirth or discoloration, there is some form of laxity. Anybody, anyone from 15, 20, 25, 30, 40, we can actually treat them.
Thank you so much. And we're here at SpectroMed. So aside from SpectroMed, where is your other clinic?
I
Or
hold
where can
clinic
we-
at Makati Medical Center. You can actually look at, like my Facebook page, a Herrera Wellness Group, and you will see all the things that we've talked about, and maybe Lani here will soon be part of the Herrera Wellness page as she blogs about this.
I will. Thank you so much.
You're welcome.